Paradise Ridge Dentistry.
Hi, I'm Ron Wolfley. I'm here with Caitlin, the lead dental hygienist from Paradise Ridge Dentistry. Caitlin, welcome back.
Thanks for having me back, Ron.
Hey, the last time we were together, we were talking about how there's people walking around, 3 out of 4 people that have some form of gum disease.
That's absolutely true. We also touched on what they can expect during their exam and how we can diagnose what they need as far as gum disease or healthy tissue.
You know, I remember that, as a matter of fact. Can you explain to me, because supposedly there's not just one type of cleaning, there are 3 cleanings. What are they?
Yeah, there's definitely a range of cleanings depending on what you need personally, what your gum tissue looks like. You have a healthy mouth, healthy cleanings. Those are your regular cleanings. We call them prophylactic cleanings or preventative cleanings because we're preventing gum disease. There's also the term gingivitis. I'm sure we've heard that from all the Colgate commercials. And with gingivitis, we get, kind of red, irritated, bleeding gums, and we treat that with a gingival scale. If you let that sit, the next step up is you needing some kind of periodontal therapy. And that's a more invasive type of cleaning needed for some severe gum disease.
So what are we going to talk about the next time you're in, Caitlin?
Next time we come in, I think I'd like to debunk the deep cleaning.
Debunk the deep cleaning.
Yes.
Sounds like a winner.
For more information, text TOOTH to 620 620. That's TOOTH to 620 620.